Hello, everyone. I am Dr. Maura Quinlan. I'm a practicing OBGYN and the Women's Health Medical Advisor for the Illinois Department of Public Health. And importantly, since January is Cervical Cancer Awareness Month, I'm a wife and a mom of 3 young adult kids, and I have been getting the routine test to screen for cervical cancer since I was in my 20s. These tests are critically important for every eligible person because in the US, cervical precancer is diagnosed and treated in about 100,000 people every year, and cervical cancer is diagnosed in 14,000 people every year. 4,000 people in this country will die from cervical cancer this year. All these numbers are too many because cervical cancer is almost entirely preventable. Cervical cancer is preventable because precancerous changes can be diagnosed with routine PAP and HPV screening and treated before the cells can turn into cancer. So let's back up. The cervix is the opening of the uterus at the deepest part of the vagina. Screening for cervical cancer involves a PAP test and a test for the human papillomavirus, generally called HPV, and which test is done depends on your age. Risk factors for cervical cancer include ever being sexually active, smoking, or having a weakened immune system. But everyone is at risk, especially since almost everyone will be exposed to HPV in their lifetime. So let's talk about prevention. A pap test looks for precancerous cells, and almost all cervical cancers can be prevented by finding and treating these precancerous changes to prevent progression to cancer. The test for HPV checks for the presence of cancer-causing virus. Pap test should start at age 21 and should happen every 3 to 5 years, depending on your age. And testing for HPV with a Pap test starts at age 30 and should be at least every 5 years, depending on your age and history. Cervical cancer screening can stop at age 65 if you have no history of cervical cancer or recent abnormal PAPs. If you are 65 years or older, talk with your provider to see if you can stop cervical cancer screening based on your own health history. It's important to note that more than 90% of cervical cancers are caused by this very common human papillomavirus, HPV. And one of the greatest scientific advances over my career has been the HPV vaccine. Imagine there is a vaccine that prevents this virus from causing cancer of the cervix, as well as other cancers that HPV virus causes, including genital and head and neck cancers for both men and women. 27,000 people a year are diagnosed with cancers caused by HPV, which translates to one person every 20 minutes. This amazing HPV vaccine, which is safe and effective, works best when given at age 11 to 12, but can be given up to age 45 for women and men who didn't get the vaccine as a teen. I cannot stress this enough. Getting this vaccine will almost completely eliminate your chance of getting the cancers that HPV causes, cervical cancer, as well as head and neck cancers and other genital cancers in both men and women. I was so relieved that this vaccine was available when my kids were teenagers so they could get it at the right age. You might be thinking that maybe you don't need a pap test if you receive the HPV vaccine, but you still need to have cervical cancer screening. The great news is that increased awareness and early detection through regular screening and HPV vaccination have put cervical cancer deaths on the decline. It is important to stress again that PAP and HPV testing for cervical cancer screening can detect cancer early when it is most treatable. If you are a woman over 21, talk with your healthcare provider about scheduling your annual exam and whether you are due for a PAP test and or HPV testing for cervical cancer. And ask about the vaccine if you haven't received it already. It could save your life. If you are worried about cost, the Illinois Breast and Cervical Cancer Program offers free mammograms, breast exams, pelvic exams, and pap tests to eligible women. You can find a provider near you by calling the IDPH Women's Health Line at 1-888-522-1282, or you can Google IDPH pap tests. I Google that, it works and will get you to the site. Early detection of cervical cancer can save your life, so please call today and make your appointment. Do it for yourself, do it for your family. Be well and have a great January and a great 2024. Take care.